My name is Sharon Miller. I'm the Director of Therapy at Rehabilitation Hospital in Northern Indiana. And today I'm going to talk a little bit about brain injury, talk about types of brain injury, and some difficulties that patients may have because of a brain injury. And the last thing I'm going to talk about is what inpatient rehab can do for patients who've had a brain injury. So brain injury can be classified in two major ways, non-traumatic and traumatic. A traumatic brain injury means an injury to the brain is a result of direct force to the brain. So like car accidents, sports injuries, falls, violent acts, like if someone's hit over the head, gunshot wounds. For military personnel, it could be involved in an attack or a bomb blast, those types of things. And they are classified as mild, moderate to severe based on the amount of time they've lost consciousness as well as the memory loss that's present. And the other type is non-traumatic brain injury, and those would be injuries that are a result of non-trauma or no direct force to the brain. So things like strokes, which is the leading type of non-traumatic brain injury, lack of oxygen to the brain tumors, inflammation or swelling in the brain, or infections. So patients who have either a non-traumatic or a traumatic brain injury can have difficulties in a wide variety of areas and varying levels in each area. So some patients may have difficulty with speaking, some may have difficulty with swallowing, memory, concentration, sensation, vision changes. They may have difficulties in doing basic activities of daily living. Their balance may be different, strength and endurance. They may not be able to walk or walk as well. And they may also have some changes in emotions and behaviors. So if those patients are deemed appropriate for inpatient rehab, it means that they have enough medical need to come here and be seen by a physician every day and need nursing care 24 hours a day, 7 days a week. But they also have to participate and be able to participate in an intensive therapy program. And that means participate in at least 3 hours of therapy, 5 out of 7 days a week. And that could be occupational and physical, or occupational, physical, and or speech. Most patients have all three if they've had a brain injury. But inpatient rehab is truly an interdisciplinary program using the goals of the patient and family, as well as the expertise of this entire team, not just physicians and nurses and therapists, but dietary staff and respiratory therapy and psychology staff as well, to help with some of the changes that have occurred. So while in inpatient rehab, we would focus on things like their thinking skills, their concentration and memory, problem solving, speaking if their speech sounds different, or language skills if they have a hard time expressing themselves and understanding, swallowing, teaching them strategies to compensate for vision issues, helping them with activities of daily living, and basic would be like bathing, grooming, and dressing, or even higher level like cooking, financial management if they do the checkbooks at home, as well as medication management. We work on strength and endurance, balance. If they have ambulation problems, we work on walking and helping them improve in all those areas. We teach strategies for the visual issues as well as sensation issues and emotional issues. So many patients have difficulty coping and understanding what happened to them. So education is provided for that. And we help them if they've had changes in their behavior or their mood and affect. It's just definitely a team approach, working on a variety of things as the patients need them. And the big goal is to get these patients home. So our plan is to work with the patients and families to meet their goals, get them home so that they continue with either home health or outpatient therapy to continue their road of recovery.